Hello and welcome. I'm Saad Dinno, pharmacist and co-owner of Acton Pharmacy, Keys Drug in Newton, and West Concord Pharmacy. I would like to welcome everyone back to our show, A Healthier You. Our goal is to discuss relevant health topics and provide information to you, our viewers, that would guide you to a healthier lifestyle. Today's topic is skin cancer, or skin care. I'm pleased to welcome Dr. Ira Skolnik, a dermatologist from Family Dermatology P.C. in Concord, Massachusetts, and the president of Massachusetts Academy of Dermatology. With summer underway, Dr. Skolnik is here to offer advice on how to enjoy the summer sun while still being health conscious about the impact of sun on your skin and overall health. Skincare has emerged as an important health concern over the last decade. While the interest in skincare continues to grow, so does confusion about skin products, disease, and treatments. Over 2 million Americans are diagnosed with skin cancer every year. With such alarming numbers, it is important to understand how to recognize symptoms of skin cancer and how to prevent it. Dr. Skolnik, thank you so much for being here with us today. Please tell us a bit about yourself and your practice.
Sure. Thanks so much for having me. I'm honored to be here.
Thank you.
I am a dermatologist in private practice in Concord, Massachusetts.
Okay.
Been in practice for about 18, 19 years in this region. I have a private practice. I see patients of all ages,
Okay.
From 1 day old or 1 hour old all the way up to senior citizens. And we take care of mainly medical dermatology issues, skin cancers, rashes, hives, warts, fungus, things like that. I do have a special interest and special certification as well in pediatric dermatology. So I see a lot of children in my practice and usually see a lot of their parents too.
I know you're a very busy guy. Not only have your own practice, but you're also the president of the Massachusetts Academy of Dermatology. Can you explain that, your
Sure.
role in that,
Sure.
please?
So the Massachusetts Academy of Dermatology is the professional society or the professional organization which represents just about all of the practicing dermatologists in the state of Massachusetts. Massachusetts Academy of Dermatology has been around since the 1950s. Okay. I'm very honored to be, I think, either the 12th or 13th president of that society. Wow. Since its inception, elected about 3 years ago. And what the society mainly does, it's a collegial society of practicing dermatologists, and what we mainly do is offer venues and forums for the dermatologists in the state to exchange ideas, okay. Bring us all up to date on the latest treatments, and there's a little bit of a social aspect to it too. We get to know each other very well. Absolutely. We know each other's families, and through bonds and friendships of that nature, we actually promote dermatology in the state on the state level, also on local levels in different towns like this one here in Acton. Absolutely. And we also have a big legislative component as well to what we do, fighting for the state to recognize the needs of dermatology practices, the needs of patients when it comes to skin care. I think the main thing that the Massachusetts Academy of Dermatology is most proud of in the last 5 years is helping to pass the tanning bill legislation in this state, which passed a couple of years ago, which makes it illegal for anyone under the age of 18 to go tanning, and that was mainly due to the efforts of our society.
Well done. I mean, as you know, that's there was a lot of issues with that, so well done on, on the Academy for doing that.
Thank you.
And I also, as well, you were presented with the Presidential Citation Award in 2017. Congratulations.
Thank you.
Can you please share with us what that was all about?
Sure. Thank you. That came as a bit of a surprise to me. That's the Presidential Citation Award is actually given out by the not by the President of the United States, but by the President of the American Academy of Dermatology.
Nice.
Which is the national society representing all the dermatologists in the country, of which there are several thousand. And each year, the American Academy of Dermatology gives out 10, 15, 20 awards to dermatologists in the country that they feel have made an impact on either the practice of dermatology or promoting good skin care for patients in the country. And I was awarded it last year in 2017 for the efforts on behalf of the Massachusetts Academy of Dermatology for the a united front that we have for advocating for patients' rights and for physicians' rights in this state.
Well done, and congratulations, Doctor.
Thank you.
I know how much passionate you are about your practice and dermatology in general.
Thank
so
you.
Well
Thank
done.
you.
Thank you so much. Many people question how much they should trust sunscreens in the summer. Even ones with very high SPF, and we could maybe explain what SPF is just to our audience. That would be incredible, Dr. Skolnik. What are your suggestions on SPF values, and what recommendations do you make about applying sunscreen?
So that is, Saad, that is a great, great question. And I get asked that question this time of the year in my practice. I'll get asked it 10, 15 times a day. So I'm very happy to explain it. So SPF, first of all, stands for sun protection factor.
Okay.
And that's the little number that you see on the label on the outside of the bottle. And that's an indication of how well or how much of the sun's rays that particular sunblock can block from reaching your skin.
Okay.
And of course, we've got ultraviolet A and ultraviolet B are the two main types of rays. And the SPF factor is really measuring the UVB rays, which we now know, not to get off subject, are the rays that we're not actually most concerned about. It's the UVA rays.
Gotcha.
But suffice it, until we get a better SPF rating system, we go with what we have nationally.
Okay.
So an SPF, for example, of 30 blocks 29 out of 30% of the sun's rays. So only 1/30th of the sun's rays will actually get through to your skin. That's the way to think of an SPF.
Okay.
So very, very small amount. An SPF of 60, only 1/60th of the sun's rays will get through. Now, that doesn't mean that an SPF of 60 is twice as good as an SPF of 30.
Okay.
Because the difference between 1/30 and 1/60 is not double the difference.
Correct.
Instead of allowing 3% of the sun's rays to get in with an SPF of 30, for example, an SPF of 60 will allow only 2.5% of the sun's rays to get through. So it's a very small difference.
Okay.
So people should not get caught up on numbers, in my opinion, and this is what I tell my patients, above SPF 30. An SPF 30, an SPF 60, and SPF 100 are all fine.
Okay.
Even an SPF of 15, we used to say up until a few years ago, was fine. Very little difference between a 15 or a 30. You really do want to have a sunscreen, though, that has a 15 or a 30 or higher. Back when I was a kid, in the 1970s and 80s, you really couldn't find an SPF more than 7 or 8 or 9, and an SPF of 15 was the highest on the market.
Okay.
Now it'd be very hard for you to find an SPF under 30. So don't spend extra money buying an SPF that's over 30. If there's a very, very small cost differential, fine, but don't waste the money, just get an SPF 30.
And the question becomes, Doctor, which is, so if you have a high SPF sunscreens, and some people will buy it no matter what, do they have to apply it as frequently as those of lower SPFs? And
Yes.
I'm guessing by what you just told us, probably yes. But
That's a great question, another terrific question. So yes, it doesn't mean that if now I bought an SPF of 60, so I only need to apply it half as often as an SPF 30, and since I don't have time to keep applying sunscreen, I'll get the 60 because I know I don't have to apply it as often. Not true at all.
Okay.
Sunscreens, if you read the package inserts very carefully in the labeling, they will all say that they need to be reapplied about every hour and a half, 2 hours during a midsummer peak day in July or say August. If you're sweating a lot, if you are going swimming, working out, anything where there's a lot of moisture on your skin, it really needs to be applied immediately after the moisture is off of your skin.
Okay.
Sunscreens, I get asked, waterproof, water resistant.
Thank you, yes.
Do they really work as well as the bottles say they do? There's been an ongoing battle between the American Academy of Dermatology and the sunscreen manufacturers in terms of labeling. American Academy of Dermatology feels that, and I, by the way, just to make it clear, I don't speak on behalf of the American Academy of Dermatology. I'm just a member like everyone else, all the other dermatologists. But there is a lot of confusion out there about water resistant and waterproof, and the general feeling is that there's a little bit of a mislabeling going on and a little bit of a false sense of security when people apply a sunscreen that's labeled water resistant or waterproof, that they don't have to reapply it. That's actually not true. Water resistant, waterproof may give you a little bit longer benefit if you've been in the water or you've been sweating, maybe, and when I mean a little bit of a benefit, I mean maybe an extra 15 or 20 minutes at the most, not an extra hour or 2 hours. So it still needs to be reapplied. So sunscreens should be reapplied about every 2 hours, regardless of what SPF is on the bottle.
And regardless of activity.
Right, and regardless of activity.
You go to water, you come out,
correct,
do your best to spray again.
Correct.
For extra protection.
Correct. Interestingly, if you, again, read the manufacturer's guidelines for a lot of these sunscreens, a bottle of sunscreen, an 8 or 10 ounce bottle of sunscreen, should last one adult in the middle of the summer about 2 weeks. And it should last a family of 4 about 3 or 4 days. Now, how many of us can say we actually follow those guidelines? Even dermatologists. It's hard for us to do that. But the truth of the matter is, when I hear people coming into my office and they say, you know, Dr. Skolnik, you told me to apply the sunscreen every couple of hours, and I did, and I was still getting suntanned, so therefore the sunscreen didn't work. That's the number one thing I hear. The sunscreen doesn't work, or I use sunscreens and none of them work on me. I tan anyway. But when you really dig down into it and you start questioning them, did you really reapply it every 2 hours? Did you really reapply it after you sweat? People start thinking of what they did, and then they realize they probably didn't.
Did not. From experience, they probably did not.
That's right, exactly.
Do you is there any effectiveness from a clinical perspective between a spray or a cream? Topical.
What we say, what we as dermatologists tell patients is this. Use the sunscreen that you like, because that's the sunscreen you'll use. If you prefer creams and somebody says, oh, this spray is much better, you should try it, but you try it and you don't like it, you might give up on all sunscreens because you said, well, if I can't use the best one, I might as well not use it at all. If you like the cream, use the cream. If you like the spray, use the spray. However, in terms of efficacy, which is how well a sunscreen works, if you think about it, if you're using a spray and you're spraying your body, you may not be getting as much sunscreen on your skin as you think you are, as opposed to, say, a cream where you can see a defined amount of the cream on your hand and you're rubbing it in. With a spray, it's a little harder to tell how much you're getting, and studies have shown you're probably not getting as much sunscreen as you think you're getting when you're putting a spray on. You may be applying it to broader areas of your body, so you may be getting, say, your whole arm, whereas with a cream you may be missing parts of your arm, for example. But you may not be getting that actual SPF that's recommended on the labeling on the bottle because you're not putting enough sunscreen on. The other concern that I do have specifically about sprays, especially in children, is the aerosol itself. The propellants that are in that sunscreen that help give it that spray characteristic. We always tend to wonder, we as physicians, what are the propellants? Are they getting inhaled? Could they be dangerous? How about, are they affecting people nearby? Are they breathing in those propellants as well, those aerosol ingredients? I think that more studies still need to be done on the actual effect of inhaling some of these propellants. I usually don't like to recommend that they're used in small children, say under the age of 4 or 5, even children 6, 7 years old, unless they can hold their breath while the parents are applying the sunscreen and cover their eyes and keep other people away. But there is an advantage to spray, and that is that you can, you know, if you've got a moving child and they won't sit still, sometimes it's easier to spray them. So it winds up being personal preference.
Okay. Thank you so much on those answers so far, Doc. I appreciate it. I go to the beach and I get burned. I applied my sunscreen, but I still somehow end up with a sunburn. What's the best next steps that you recommend to your patients?
I do get this question a lot too. All terrific questions, right on the money.
Thank you.
So first of all, I know it's sort of like the horse is already out of the barn, but let's try to prevent sunburns to begin with. Let's stay out of the sun between peak hours, between, say, 10 or 11 a.m. and 3 p.m. when the sun is highest in the sky and the rays are the strongest. Let's seek protection, get into the shade. Let's try to prevent the sunburn to begin with. But if we're unfortunate, if we're at a soccer event watching our kids play and there's no shade and you're inevitably going to get a sunburn by accident even though you did everything you could, first of all, for the pain itself, usually Tylenol or ibuprofen, maybe all you need. And cool baths in bathtub soaks can be very soothing. Drinking lots and lots of fluids, because when you have a sunburn, your body's skin barrier is disrupted, and sometimes it doesn't allow heat to escape, and it might trap things in your skin. So drinking lots and lots of fluids to keep hydrated. And of course, if you feel sick, if you feel nauseous, if you start to see blisters coming up, it's just something's not right, headaches, fatigue, muscle pain, those could all be signs of not just a sunburn, but even of sun poisoning or heat stroke. So seek medical attention. Urgent care clinic, preferably one staffed by a physician, or a local emergency room if it's bad enough, or maybe giving your doctor a call, asking for advice over the phone, but definitely seeking medical attention. But moisturizing creams, aloes actually do help. They do. They absolutely do. I would try to tend to stay away. There's a lot of sunburn creams on the market. You start reading the ingredients. They have lots of all-natural ingredients that purport to, take care of sunburns. There's not a lot of scientific data on those. Stay away from things with fragrances and things like that, perfumes, dyes, because they can actually be irritating to the skin. But also knowing if you've got a very minor sunburn, knowing that it will pass. It may take a day or two. You'll start to feel better day by day. But it's really important to know that every sunburn that you get, especially as a child or even later in life, does increase your risk for skin cancer significantly during the course of your lifetime. So the best treatment is prevention.
And prevention by applying sunscreen.
And staying out of the sun during peak hours.
You mentioned you have a subspecialty in pediatrics.
Yes.
So, we get this asked at the pharmacy all the time, doctor. There's some specific sunscreens that are for children, some for adults. At the end of the day, it doesn't matter.
No.
Okay.
It does not. Another terrific question that I do get asked a lot of times during the day. Sunscreens that are labeled for babies, for children, they're probably hypoallergenic, which is great. That's terrific.
And what does that mean real quick, Doc?
Hypoallergenic means they've taken out a lot of the extra ingredients that they might put in, say, an adult sunscreen, something that makes it smell nicer, something that gives it a little bit of more of a texture or a little bit of a coloring to it. People probably don't want to put things on their skin that are pasty yellow that look like they've expired, so sometimes sunscreen manufacturers add artificial colors to them to make them look whiter and purer. And they may add scents to them, small amounts of scents and fragrances so that the scent of the sunscreen itself isn't overpowering. Well, sunscreens labeled for babies or for children usually don't have those ingredients. They've taken them out. Well, that's terrific. Then they can label it hypoallergenic, but labeling it for babies or for children, true, it can be for babies or for children, but it's a little misleading and it's a little bit of a marketing gimmick on behalf of the sunscreens to sort of target parents into thinking they've got a sunscreen specifically for babies or children. As a matter of fact, some of the ones recommended for babies or children, I recommend for adults who may have sensitive skin. I think they're perfect for adults with sensitive skin.
So just a follow-up question real quick, is that if a mom goes to let's go to the pool or to the beach and they forget the baby-specific...
Yeah, use the adult one as long as it doesn't cause any reactions and the baby's fine. Of course, we don't really recommend sunscreens for under the age of 6 months old, 6 months, 7 months old. Those children should be kept out of the sun anyway.
You just answered my next question, so thank you so much.
Exactly.
So do not apply sunscreen to...
Well, it's not a do not apply, it's that there's no actual FDA seal of approval, let's say, for sunscreens under the age of 6 months. It's not that they're dangerous.
Right.
It's not that if you accidentally apply a sunscreen to a child who's 4 or 5 months old that something bad is going to happen to them. That's not the case at all. It's just if you go by the actual FDA approval, it's usually recommended not for under the age of 6 months because, quite frankly, first of all, those children shouldn't need sunscreen because they shouldn't be in the sun to begin with. And second of all, children of such young ages do have sensitive skin. Yep. Their absorption through the skin can be a little bit higher, so we don't want to be putting things on their skin that really aren't necessary in terms of adding chemicals to their skin that could be actually irritating to them.
Thank you so much.
Sure.
You hit earlier on tanning beds. I'm assuming, and it's a big assumption that they're not good for your skin.
They're terrible for your skin.
What is the difference between tanning outside and tanning in a?
So tanning outside from the actual sun,
Yeah.
you're getting a broad range of ultraviolet light. You're getting even gamma rays and other rays that that the naked eye can't even see.
Okay.
The outdoor sun can be friendly to your skin if it's used properly. It promotes vitamin D, but although we don't recommend you get your vitamin D from the sun, we recommend that you get it from your food or from supplements.
Yep.
But the sun makes us feel better, just in general, puts us in a good mood. I mean, who's not in a good mood, when spring comes after we, have lots of sunlight? Sun makes all of us happy.
Yep.
So not to minimize the sun. However, the sun has a lot of harmful effects on our skin as well. Tanning beds use special ultraviolet lights, and there might be different types of tanning beds with different types of lights, specifically to promote tanning of the skin, either ultraviolet A or ultraviolet B, or even some types of visible light or blue lights or things like that. And the fact of the matter is that you're really not getting any of the beneficial sunlight when you go to a tanning booth. You're getting the sunlight specifically directed at tanning your skin. That's where the tanning industry makes its money. The tanning industry, quite frankly, doesn't care less whether your vitamin D levels are good or bad. What they care about is promoting their industry, like any other industry in this country. And I'm sure there'll be a lot of people from the tanning industry that disagree with me, but the American Academy of Dermatology and the Massachusetts Academy of Dermatology are very strong opponents of tanning beds in general. Especially, I told you we had legislation passed in this state, so no one under the age of 18 should be tanning. Think of tanning beds are to your skin what cigarettes are to your lungs. Cigarettes are still legal. You can smoke them if you're over the age of 18, 21, whatever the law is. We've known for decades and decades that smoking causes skin cancer. Smoking causes lung cancer. There's a direct link with that. Cigarettes are still legal. We know that tanning beds cause skin cancer. Tanning beds are still legal. We just want people to know what the facts are before they make decisions. Since we're on the subject of skin and sun and skin cancers, we can first talk about skin cancers. So the three types of skin cancers that we see most often and that people hear about in the public are starting from least invasive to possibly most invasive are, first of all, basal cell carcinoma. Okay. Basal cell carcinoma by far is the most prevalent type of skin cancer in the United States. Okay. I think Bill Clinton has had a couple removed on his face, and Ted Kennedy, when he was around, had many removed on his face. They're very common. You go down into Florida where people have gotten a lot of sun in their lifetime. They're very common on people on sun-exposed areas as well. Basal cell carcinoma is usually easily treatable if caught early, like most skin cancers, I should say. Usually treated by surgical removal, or if it hasn't invaded below the top layer of the skin, even some topical medicines or scraping, or just a small excision. The next most common type of skin cancer, getting a little bit more rarer, would be squamous cell carcinoma. Okay. Squamous cell carcinoma, a little less prevalent, but also can be a little more invasive, sometimes a little harder to treat. Also sun-exposed areas of the body, usually we see face, tops of the ears, backs of the hands are the most common places to get squamous cell. And I can talk a little bit about what these look like in a minute. Again, if caught early, very easily treatable, either with excisions or creams or small scrapings.
Okay.
And then the least common type of skin cancer, but the most deadly by far, is the one that everyone dreads getting, and that's melanoma.
Yep.
And melanoma can be found, again, sun-exposed areas, but not necessarily. There's a genetic component to all of these skin cancers,
Sure.
Including melanoma. I like to tell people that the two things that can cause skin cancer, of course, are sunlight and genetics.
Okay.
You have no control over your genetics.
Absolutely.
But you do have control over your sunlight, so do the best you can with the things you have control over, and don't worry as much about things you don't have control over. Minimize your risk, in other words.
Okay.
Melanoma can be invasive and can be deadly. Again, very treatable if caught early. Basal cell and squamous cell carcinomas, what we look for on the skin are usually little red, scaly discolorations in the skin, or they can be little bumps on the skin that don't heal. They can bleed sometimes. Sometimes they can even be itchy.
Okay.
Melanoma, people typically know, are the brown spots that can happen on people's skin, differentiating them from normal moles or freckles. So don't panic if you've got brown spots on your skin. It doesn't mean you have melanoma. You look for what we call the ABCDEs of changes in moles, A's being asymmetry. So if you have a mole that's brown and you draw an imaginary line down the center of that mole with your eyes, do the two halves of the mole look alike, or are they asymmetric? Asymmetric could mean it could be a changing mole, or it could be becoming melanoma. B is border. We look for the border. Is the border nice and smooth like a donut or a baseball, or is it jagged and kind of, irregular? C is color. Are the colors uniform? Does not have to necessarily be brown. It can be a lighter shade of tan, could be darker brown to almost black, but is the color even? If the color is even, less worrisome. If the color is uneven, could be something to have checked by your dermatologist. Okay. D is diameter. We like to think of moles as being, they should be sort of under the size of an eraser on a pencil, or smaller. Moles that are bigger than that don't necessarily mean they're dangerous, but do warrant further investigation by a dermatologist. And then E is the new criteria which evolved over the last several years, which stands for evolution. So mole may not have any of those features, but is it evolving? Is it changing over the last several months or years? And a changing mole probably does warrant investigation by a physician.
And the best way to do that is by
self-examinations first, or
you.
by your primary care doctor, and when and if there's any doubt, seeing a board-certified dermatologist. Can't stress that enough. We are seeing in the last 5 to 10 years, unfortunately, a lot of primary care physicians or non-physicians calling themselves skin specialists or dermatology specialists without maybe using the word dermatologist, which connotes a board-certified physician in dermatology. So just, I would say to patients, make sure your physician who's examining your skin is a board-certified dermatologist.
Dr. Skolnik, thank you so much.
Thank you.
Thank you so much. You shared a lot of awesome information for our audience.
Thank you.
As the summer is here and is approaching, and we're all going to hit the beach and have outside activities, thank you so much for being here.
It's an honor to be here. Thanks for having me.
Dr. Skolnik, thank you so much again for taking the time to be with us today and sharing your expertise. You have provided some very useful information on how to enjoy the sun while staying safe. Thank you all for tuning in to A Healthier You. I am Saad Dinno, co-owner of Acton Pharmacy, Keys Drug, in Newton and West Concord Pharmacy, and I look forward to seeing you around town. Be well.